Hi, I'm Dr. Watt, the Healthy Neurosurgeon. I want to talk to you again about omega-3 fatty acids. I've mentioned before about the importance of high levels of omega-3 and low levels of omega-6 in your diet to be healthy. But I never mention where do you see the highest level of omega-3 fatty acids in your body. The highest concentration is in breast milk. Right behind that is brain tissue, and that's not a coincidence. Women already complain about labor and delivery, and, well, if they had to deliver something almost the size of a bowling ball, we'd never hear the end of it. So the trade-off that Mother Nature makes is babies are born with brains that are not yet fully developed. It's what you have to do to get the head down to a deliverable size. What's missing for the most part in these neonatal brains is myelin. Myelin's a fatty substance that forms the covering over neurons in the brain. You can think of it as the insulation on an electrical wire. It's vitally important for the neuron's function, and developing the myelin in the brain is therefore really important for meeting developmental milestones. Obviously, if you're going to be putting myelin down, you have to have the substrate for it. The myelination starts at about 24 weeks of gestation, but it's not finished in a child until he's 2 years of age. 2. So it's absolutely vital that a pregnant woman have adequate omega-3 fatty acids to support development of the baby in utero. It's also important that lactating mothers have adequate omega-3 fatty acids. Studies have shown that the concentration of omega-3 fatty acid in a given woman's breast milk is directly related to the amount of omega-3 fatty acids in her diet. So if mom's not getting enough omega-3s, then her breast milk doesn't have sufficient omega-3s to support the baby. And once the baby comes off the breast, or if for some reason the baby couldn't be breastfed, then it's really important that supplemental omega-3 fatty acids are given in addition to the formula. And I said supplemental. As a grandfather, I've looked at the formulas that are out there. None of them have an adequate amount of DHA in them. And a lot of them actually have stuff that baby doesn't even need while they're trying to convince you it's good for your child. So make sure you're getting adequate omega-3s if you're pregnant. Make sure you're getting adequate omega-3s when you're nursing. And if you're not nursing and are giving formula, you have to make sure you're giving omega-3 fatty acids. There's good liquid ones out there in addition to the formula. Look, the omega-3s are good for you. They're good for your baby too. It's not brain surgery.